Good afternoon. The 4 November 2012 meeting of the Council on Aging is called to order. Will you please stand for the Pledge of Allegiance? Commissioners, turn on your microphones. This Sunday is Veterans Day. We have two veterans with us who are veterans of War II, Leon and Harry. In honor of those veterans, all of our veterans, and the people who are currently deployed, all the men and women, let us recite the Pledge of Allegiance. And Nancy, will you please lead us?
Yes. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Play ball.
Francine, our staff liaison, will you please call the roll?
Commissioner Fotheringham?
Here.
Commissioner Grimm is absent. Commissioner Healy? Here. Commissioner Lopez? Here. Commissioner Loomis?
Presente.
Commissioner Norkin? Here. Commissioner Shentes? Here. Commissioner Searden?
Here.
And Commissioner Wing?
Here.
Thank you.
Thank you very much. We are now on item 4, public comment, and this is the time when we invite people who would like to address the council and the audience on concerns for seniors, on items of general interest, making announcements. And we have two people who have pulled speaker cards, and the first one is someone that we're very familiar with, Ms. Irma Tucker.
Thank you. My name is Irma Tucker. I live in Westlake Village, and I am a member of the SAMP housing team. And this is a information item for the members of this audience as well as the home audience regarding a public meeting that is being held by the City of Thousand Oaks tomorrow evening. It's at 6:30 in the boardroom here. And the purpose of the meeting is to seek input for the housing element update. It's the housing element of the city's general plan. And this is a really good opportunity for anybody who's interested in housing issues in the city to have an input on what happens in the community. Some of the topics on which the city is seeking input include housing needs for persons of all income levels, housing for people with special needs, including persons with disabilities, constraints on the development of new housing, and strategies for preserving and encouraging new housing. This is the beginning of a process that is going to take a few months and will be coming before the City Council probably sometime in 2013. And the SAMP housing team will be participating in this housing element update process. So if you have any information on, if you would like any more information on this, contact Jeff Spector at the city, or you can ask me. And anybody who's interested, even just out of curiosity to see what the process is like, it's a really good opportunity to come. Thank you.
Thank you, Irma. And our second speaker is someone else with whom we are very gratefully familiar, Ms. Brenda Birdwell of Senior Concerns.
Good afternoon. Happy November, everyone. How's everybody today? My name is Brenda Birdwell, and along with Betty Berry, who's our scheduled speaker today, I'm a senior advocate for Senior Concerns. Betty and I share an office at the Goebel Senior Center. The address is 1385 East Jans Road in Thousand Oaks, and we're available from 10 to 3, Monday through Friday. Our phone number is 805-495-6250. Senior Concerns Adult Day Program is at 401 Hodenkamp, also in Thousand Oaks, where we have our Adult Day Center and our administrative offices. All of the information that I'm going to be sharing with you this afternoon, don't worry, it's not that much. It won't take that long. All of the information is available on our website. That's www.seniorconcerns.org. So here's what you have to look forward to next week. On Tuesday, November, I have to put my glasses on. This is when I pretend I'm not a senior. On Tuesday, November 13th, our esteemed Betty Berry will be talking about Social Security. She's going to explore the benefits available, separate fact from myth, and learn about what's changed in the history of Social Security. So that will be next Tuesday, November 13th, from 1:30 to 3. It's at the Simi Valley Senior Center. The address is 3900 Avenida Simi in Simi Valley. You can call 805-583-6363 to sign up for that one. The next day, on Wednesday, November the 14th, Betty will be talking about identity theft, fraud, and scams. That will be at the Westlake Village Civic Center. The street address is 31200 East Oak Crest in Westlake Village, and the time on that is 1:30 to 3 as well. Then Thursday, November the 15th, we're continuing our Solving the Puzzle Aging series. This series is also about caregiving, and this one is about hassle-free holidays. That's going to be at our Adult Day Center at 401 Hodenkamp. The number there is 805-497-0189, and that is from 3 until 5 o'clock. Last but not least, November is National Memory Month, and in honor of that, Senior Concerns at the 401 Hodenkamp address is having a Memory Day. That's going to be Saturday, November 17th from 8:30 to 12:15. So you're all going to want to try to get involved with that. Call in to say that you'd like to come in. They're actually going to have professional screeners doing memory screenings right there. It's a really great event. They haven't done it for a couple of years, but it's a really important, great event for the community. So again, my name is Brenda Birdwell. My number is 805-495-6250, and all of this is available at the Senior Concerns website, which is www.seniorconcerns.org.
Thank you so much, Brenda. For those of you in the audience, and there are several here in the room who are not very much aware of Senior Concerns, I urge you, get on the net, take a look at the website, or even drop by Senior Concerns and find out the breadth of what they do and how they do it. Because my guess is almost everyone in this room is going to need their help. And what they do very, very well, and we're so pleased to collaborate with them. Now, our next item, item 5, guest speakers. And for guest speakers, I'll ask Commissioner Jim Searden to make the introduction.
Thank you, Leonard. Well, I was thinking of ways to introduce our next speaker, going through all the adjectives I know, and I came up with these words, which I think says it best. Ladies and gentlemen, Betty Berry.
Thank you, Jim. I'm glad that's all you said. Hi. Today I'm here to talk to you about Medicare 2013, what's new. But before we get into the program itself, I have to ask some questions. I see that Brenda is counting heads. Because we're a nonprofit, we need to turn in reports as to how many people we spoke to and where they came from. So I'm going to give some questions out, and I'm going to ask you to answer them. Will you count heads and men? Okay.
I think I can figure them in out.
Okay. When we go before the city councils to ask for money to run our programs, they want to know how many people we talk to, and then they ask how many men did you talk to. They don't seem to care that we talk to any women. And it was a long time before I figured it out. You men never stop and ask for instructions, so now they're trying to see how many are coming back to get some information, okay? We take part in many communities, so I'm going to go down the list of communities that we serve, and if I hit your community, would you please raise your hand? Is there anybody here from Agora Hills? Okay. How about Camarillo? Okay. Moore Park? I know there's nobody here from Ojai. That would be a long ride. Piru? Santa Paula? Calabasas, we'll go the other direction. Calabasas. Fillmore. Oak Park. Nobody, there's one, okay. Always have somebody from Oak Park. Oxnard. Port Hueneme. Simi Valley. Westlake Village, LA side. Any other LA cities that I didn't call? Okay, everybody else from Thousand Oaks. Okay, I can still add and subtract, so I can do that. Okay, now, is there anybody here under the age of 62? Okay. Somebody said, wow. How about, I'm looking now, which is the easiest way for me to do this count. How about between 62 and 75? Okay, put your hands down. Over 75. That's easier. Thank you. Okay, now I have a question for the ladies. How many ladies consider themselves female head of house? That means you either live alone or your spouse can no longer be head of house. Okay. And for everybody, how many live alone? Okay. And I wouldn't know, so is anybody in the audience considering themselves disabled? Okay. Those are the questions they ask us, so those are the questions we ask you. Okay? Today I want to talk about a number of things, but first, after doing the paperwork, I need to determine who I have in the audience, because Medicare covers a multitude of people. Are there any in the audience who are brand new to Medicare? Okay. How about who has a Senior Advantage plan? Do we know what a Senior Advantage plan is? Okay, that would be one of Medicare's HMOs or PPOs, like Kaiser, etc. How many have straight Medicare with a Medigap policy? Okay. How about Medicare with some type of supplemental policy from the government or from your retiree office? Okay. How many did not sign up for a Part D plan when they should have? Oh, you're all pretty good. Okay. And did I miss anybody? Okay, these are the combinations that we deal with, so we never know when you come in to see us or call us what we're talking about until we get you down into one of these categories. So we're going to talk about each one of those today. If I talk about the one you have, it won't hurt to hear it again because somebody in the audience doesn't know it. Yes, sir? Okay, that's a Medigap policy, sir. Okay, and I should have repeated that question. I know. Okay, before I start, aside being a senior advocate at Senior Concerns, I am a registered high-cap counselor with the state of California, and I have to read you a disclosure statement. High-cap counseling services are provided by counselors registered by the California Department of Aging to provide information to you to make informed, independent decisions about your health insurance needs. Counselors may not make the decision for you and may not make specific recommendations or referrals. Much of the information provided to you will be provided to the counselor by other government agencies or companies. The Area Agency on Aging and its employees and volunteers disclaim any responsibility for the accuracy of such information. Counselors assisting you are acting in good faith to provide information about health insurance policies and benefits. This information shall not be construed to be legal advice, and the counselors are generally not liable for acts and omissions in providing the counseling recipients of this service. Okay? We try hard, but sometimes we make mistakes. Today I'm going to cover the following subjects: Medicare Part A and Part B deductibles, Medicare Part B premiums, Medicare Part C senior advantage plans, Medicare Part D changes for prescription coverage, Medicare new preventative services available, changes due to the health care reform bill, one-stop shop workshops, review of ambulance services, review of inpatient versus outpatient hospital services, review of enrollment periods, and review of Medicare summary notices. To the council, don't worry, we can get all that done in about an hour. Medicare Part A and B deductibles. Each year we discuss the cost of deductibles for the coming year. Medicare, like everybody else, has deductibles. Part A has a deductible, that's your hospital, and it's based on a benefit period. In 2012, that deductible was $1,164. Unfortunately, Medicare or the government has not yet told us what it will be in 2013, but it usually goes up about $30 a year. So you can figure it will be about $1,200. Medicare Part D deductibles for your doctors. This is an annual deductible at the beginning of each year. In 2012, it was $140. Of course, we don't have that figure for 2013 yet, but it is tied to your Social Security increase, which was a 1.7% increase that you get in January. And looking at the past years and the size of the increase, you could probably count on about an increase of $7, bringing it to about $147. They have increased almost every year in the past, so I cannot believe that they would not increase this year. Medicare and U-Book for 2013 states these figures were not available when they wrote the book, but you can visit www.medicare.gov, or you can call 800-633-4227, and they will send you a book. By the way, this is the book. How many of you received this book in the mail? Okay, keep your hands up if you have read it. I suggest that maybe you might read this. There are many, many good things in this book, and it did cost the government a lot of money to put these out. But there are a lot of good things in here that might clear up some questions that you don't have to come to us to answer, or things that you can base a question on. Today, as I go through this, I will be mentioning page numbers for certain things that I think are important. Okay, Medicare Part B premium. Medicare Part B premiums are tied to the cost of living increase in Social Security benefits, which are tied to the amount of inflation. You know, we just keep going on and on. And since we've not heard anything about it, as I mentioned, I think it will go up about $7. Your increase in Social Security, effective January 1st, is a 1.7%, and it is one of the lowest increases that you have ever gotten. When we talk about a premium for Part B, basically we talk about the base premium. In 2012, the base premium for Medicare Part B was $99.90. I don't know why we didn't say $100, but we saved 10 cents. Those who have higher incomes will pay higher premiums. Individuals whose net adjusted gross income is $85,000 or more will pay more than $99.50. For married couples filing together, if your net income is $170,000 or more, you will pay higher premiums. This is also going to be true when I give you the premiums for Medicare Part D. These premium amounts have not yet been announced, But in this past year, if you go to that first category, you go from $99.90 to about $134 a month. Okay? Seniors usually say to me, well, I live on a fixed income. I don't make $85,000 a year. Or a couple say, I don't make $170,000 a year. These numbers are based on the last income tax return you filed. So when we're filing 2012 in 2013, they will be looking at your income tax return from 2011. If your adjusted gross income is above those numbers, you will be paying a higher premium, and Social Security will be telling you what you will pay. It's not just your income that's in that figure. Capital gains are in there, and so forth. So the one thing that really hits seniors at one time is when they sell a house. So keep that in mind. Okay, Medicare Part C. How many of you have heard of Medicare Part C? One man and one lady raised their hands. Okay. Medicare Part C covers all the Medicare plans that other than original Medicare, and these are known as Senior Advantage plans. Okay? The plans can be health maintenance organizations known as HMOs, preferred provider organizations known as PPOs, private fee-for-service known as PFFSs, say that fast 10 times, special needs plans, SNPs, HMO point-of-service plans, which is an HMO POS, and medical savings account plan. These plans are all listed here because they may be someplace in the United States. In Ventura County, we only have to worry about HMOs and PPOs. And in Ventura County, East County is different than West County. So in all of Ventura County, we have HMOs, AARP Medicare Complete, which is known as Secure Horizons. We have Aetna Medical Select. We have Blue Shield 65 Plus. We have Physician's Choice Medicare. We have Kaiser Permanente Advantage Ventura. We have Scan Classic. And we have one PPO, Anthem Medicare Preferred Standard. In this part of the county, the East County, which is made up from Thousand Oaks, Simi Valley, and Moore Park, we have 3 HMOs and 1 PPO that you can choose from if that's how you want to receive your Medicare coverage. Anthem Medicare Preferred Standard is the PPO that you can assign your Medicare to if that's what you desire. If you want an HMO, we have in this part of the county Aetna Medicare Select, Kaiser Permanente, and Scan Classic. I don't have anybody in the audience from Los Angeles, but if I did, Los Angeles residents have additional choices, and they are listed in the Medicare and You on page 136. Is there anybody in the audience who doesn't have a Senior Advantage plan, but they are thinking about it? Oh, I have a hand over there. Okay. Are you currently on another plan? Oh, your replacement from a company? Okay, yes, that's the one company this year that told retirees, sorry, but after the December date, you are no longer covered. Okay, so you are going to be looking at HMOs and PPOs. Let me just give you a few basic facts. Aetna, HMO, you're going to, if you choose that one, you have a $25 monthly premium and no annual deductible. If you pick Kaiser, you have no premium and no deductible. If you pick Scan, you have a $14 a month premium and no deductible. If you decide to go with Anthem Blue PPO, you will have a $41 a monthly premium. You will also have a $300 medical deductible and a $90 drug deductible. So if you need more counseling on that, you can see either Brenda or myself, and we'll be very glad to fill you in on the details. Most people have never heard of Medicare Part C. That's a test. Is there anybody in the audience who currently, or was, currently this year on Anthem Blue PPO? Okay, you got a letter that said you have to change. Anthem Blue PPO was here last year. They will be here again, here this year. They will be here again next year, but the plan is different. So I think your letter said you can go to any other plan you want, but you have to reinvent the wheel and you have to apply again for the new one. Yes, ma'am. Okay, the lady said they never paid a dime on anything she had. I'm sorry to hear that, but there was a deductible on it. Maybe that was why. But if you need counseling on what to choose, if you have not chosen yet, then see Brenda or see me and we can set up something for you. Okay? Sir, are you all set on what you're going to do? Okay. We'll be glad to help you. Okay, every year we go through a nosebleed of changing plans. We don't usually change our Medicare Advantage plans. We're usually happy with what we have. But in your case where you lost what you have, and in your case where they changed their plan, you have to do that. But those who, let's say somebody's on Kaiser and every year they're on Kaiser, so they don't have to do anything about it. You're on plain old Medicare and maybe you want to go to a Senior Advantage plan or vice versa. Yes. But those plans, usually you get them, you like them, you stay with them, and that's that. The biggest problem is for those of you who are on straight Medicare, you have something called a Prescription Plan Part D. This plan is something that you should look at every solitary year to make sure you are getting the best coverage for the lowest amount of money. These plans are listed on pages 139 through 139D in U and Medicare 2013. Every year the availability changes, number of insurers who will sell the policies change, the number of plans that they can sell change, the premiums change, the formulary changes, and you change. And so in order to get that all together, you need to review what you have and what plans offer what. It's in your best interest to review your needs and the current plan to determine if you have the best coverage for the least amount of money. I don't know anybody who wants to waste money when they don't have to. When do you do that? You do it now. Between October 15th and December 7th, you have the opportunity to change your Medicare Part D plan. Just to show you how they change, in 2012, we have 16 insurance companies offering 33 different plans. In 2013, we'll only have 15 insurance companies offering only 32 plans. But not all the insurance companies are coming back and new ones are coming in. So you could possibly have a plan that's going away or changing in some way, and you should have heard from your insurance company. A lot of people will just look down the list and say, well, I'll take the one with the cheapest premium. That's not exactly the way to do it. The premiums run from $15 a month to $118.60 a month. While you can't determine the coverage from the premium, I think it's interesting to see what the spread is. For those, is there anybody in the audience who doesn't take any drugs? Congratulations. For those who do not take any prescriptions or any type of any type, the lowest premium is probably the best way for you to go. 2013 has several low ones. There is a $15 premium from AARP. It does have a $325 deductible. and there's a $24.40 premium with no deductible and an $18.50 premium with a $325 deductible. My suggestion would be to take the $24.40 deductible with no premium with no deductible, so that should you get the flu or something and need something during the year, you don't have to meet the deductible. The reason I'm saying you need to do something even if you don't take drugs is if you do not buy a Medicare Part D plan when you first should, and you come back a year later and say, oh, I should have done that, you will have a 1% penalty on your premium for every month you did not sign up. And since it's a year later, that's a 12% penalty. Okay? So I try to get to people who first turning 65 and say, if you don't need drugs, that's fine. Take the cheapest thing you can find, and then you're in the plan, and you will never be faced with a penalty. The deductible, if there is one, is capped by the government. In 2012, the cap was $320. They raised the cap by $5 to $325 for 2013. To determine what plan covers you the best for the least amount of money, you really need to do some computer work. You need to do comparisons. You can do this by yourself if you're computer literate, or you can ask us to do it. We have some forms available that would require that you give us the name of your drugs, the size of the dosage, and the number that you take a day, a week, a month, or whatever. We will have those run through the computer. We'll come up with the 3 least expensive plans covering you the best, and then we can counsel you on that. We do have forms here today if you want to fill those out. It's so much fun to do that. Brenda and I were busy doing that just before we came over here today. Now, I mentioned that I was going to talk about one-stop shops, workshops. A one-stop shop workshop, say that 5 times fast, have been scheduled at most senior centers during October, November, and December. And these shops are to assist you with any question you have signing up for Part D or any other parts of Medicare. You can run your own Part D comparison if you're computer literate, or as I said, you can have us do it. If we do it, we will take your forms, we will send them up to Ventura to the high cap office. They will do the computer work. They will call you and make an appointment for you at the most convenient one-stop shop available. You come into that one-stop shop, they will counsel you on those plans. They will even help sign you up for the plan if you want, and then you walk away set for 2013. One-stop shops are scheduled, let's see. The next one in Camarillo is November 26th. Moore Park is finished. Simi Valley has one on November 14th. And Thousand Oaks will have one on November 15th, and the last one on November 30th. We are planning to be very busy at those. So if you want HICAP to do the comparison, we would certainly take your sheets and process them for you. Let's review the form. Oh, Brenda, where are you? Do you have enough forms? Okay, can we get them out and I'll just go down the form? Yes, ma'am.
Stop paying attention.
Well, I'm going to...
I've got Betty's back, so if I pass the form out now, you have to keep listening to Betty. Don't just look at the form.
Well, I'm going to go over the form with you, but then put the form aside. You know, we keep each other's back. After you fill out these forms, and if you're going to fill them out, we will collect them and take them back with us. We then review them to see if we can read them, because it's a little difficult to key them into a computer if you can't understand what you wrote. Did I give you enough? How many of you are computer literate and will do this yourselves? Oh, I got a couple of hands. Okay. Yes. A lady just asked if we don't have the full information on our drugs, can we get it to you some other time? Yes. You can take them home and complete them, and you can bring them to the Global Community Adult Center. I think we just changed our name, or Adult Community Center. You can leave them at the front desk. You don't even have to come see us, and they will bring them into us, and we will process them. Yes, sir.
Is there a website we can?
Yes, you can. www.medicare.gov. You're welcome. You can do that. You will get a lot of information. You're going to have to go through a lot of stuff, but it's there. The nice thing about the people who do it in Ventura is they've done so many of them, they can do them pretty fast. But yes, it's all there. Okay. Let's take a look at this. When you've completed the form, make sure you have signed it and all information is legible. Yes, ma'am. Yes. The names of the drugs are atrocious to begin with, so I would never know if they were spelled right, wrong, or indifferent. So make sure you get that down there. If possible, after you do it, make a copy and keep it for yourself in case we have a question, and then you won't have to wonder, oh, what did I say? Then you can either mail it or fax it to the address shown on it, or you can come deliver it to Global, and we will take care of it. When HICAP receives the form, they will do the computer work. They will call you and make an appointment for one of the workshops. We have 2 left, and I understand they're filling up fast. If you complete the form today, you can give it to us on the way out, and we will process it this afternoon. If you have retirement coverage through your previous employer, you should have received a letter stating whether or not your coverage is creditable. Because if you have a retirement plan like you did from Kodak, if you have a retirement plan, you're not required to have a Part D plan if that stuff from your employer was creditable. So when you sign up, if you're not going to go with a Senior Advantage plan, but if you go with Medicare and you need a Part D plan, then you won't have any penalties. Okay? The letter that you get from your company, if you are receiving Part D coverage from your company and you don't need a Part D plan now, you get a letter every year from your employer saying you have creditable coverage. Do not throw this letter away, because should your company in future years tell you I'm not doing it anymore, you need to have that letter to show Medicare that you did have creditable coverage. So when you get that letter, just put it with your other important papers. Now, on the form itself, on the front side, we want your name as it is printed on your Medicare card. We don't want your nickname. Home address, etc., telephone number, and please, preferred time to call. You'd be surprised how many calls we make because we don't know when you're home or when you're not home. It's asked for your birth date and your Medicare number. I do not want your birth date or your Medicare number. It's on here because should we have a problem and we have to call Medicare to straighten something out, we need that. But my argument is if we have a problem, we'll call you and ask you. I do a seminar on do not give your Social Security number to anyone, and your Medicare number is your Social Security number. So I don't want those two things running around our office. We would like the date of your Part A and Part B enrollment in Medicare. The second square on the front is if you do receive coverage from a retiree plan, we'd like to know it. If you are a veteran, we would like to know it. If you have veterans benefits, you do not have to have a Part D plan if you use your veterans benefits. You can have both, but you don't have to. If you have veterans benefits and later for some reason you don't want to use them, you can buy a Part D plan with no penalties because veterans benefits are creditable. We would like to know if you have a Medicare Advantage plan. If you have a Medicare Senior Advantage plan, you do not need nor do you want a separate Medicare Part D standalone plan. But we can, if you want, if you tell us what Medicare Senior Advantage plan you have, we can run it on those plans to see if what the coverage is for you in those Senior Advantage plans. The reason, if you're on an HMO or a PPO, the reason I don't want you to sign up for a Part D plan is if you do, you have just disenrolled yourself from your medical plan. And you just go back on Medicare then. And that isn't what you want. The other thing I want to add right here is if you have a question or if you're going to do something, you're planning on doing something, I think I'll do this. Would you call us first and tell us what you want to do? We can tell you what will occur if you do that. But what happens most times is you talk to your neighbor or your favorite brother-in-law and they say, oh, we did this, and you say, oh, I think I'll do that too. And then it didn't work, and now we have a fire and we don't know how to put out the fire. So please call us first and ask the questions first. And then at the very bottom of the front page, there is something called low-income subsidies for Part D prescriptions. If you meet the numbers in this square, check it off, and then we will see what we can do about getting you a subsidy for your drugs. On the reverse of the plan, of the paper, we have 3 columns. One is for the name of your drug, one is the size of the dosage, and one is how often you take it. So please put your name of the drug in the drug column. Please put the dosage in the dosage column. And please put how often you take it in that column. The reason I spelled that out is I had a call the other day from my veterinarian. And he said, you know, I never called you, but you keep telling me that I should when I have a problem with this, so can you send me a form? I did, and he put everything in the first column, nothing in the other columns. So I just asked that you do that. It's easier. Then would you please sign it and date it? And then we'll do the work. And it's a free service. Okay? Any questions so far? Yes, ma'am. So they're going to do it over. They do make mistakes. We had a couple today where they have turned in their sheets ahead of time, and we have gotten them back, or they've gotten an appointment date, and they come running in and say, I just went to the doctor, and he added a new one. Yeah, so we have to do it over. But, well, maybe they were trying to tell you should go on a Senior Advantage plan. Okay, if there's no questions there, and that's the big change that happens every year, that's what keeps Brenda and I in business in October, November, and December. Medicare 2013 new preventative services. Medicare has started to add preventative services at no cost to you. They are finally figuring out if they give us preventative care free, it might be less expensive because we won't get as sick as often. And they have been doing it for a couple of years, and they keep adding new items. And under the new health care bill, that will continue to happen. But new preventative services are on pages 33 through 52. Those are listing all the preventative services that are now listed. Those that are new this year have a big new written alongside of them. There is a new one, a behavioral therapy class on cardiovascular disease. So if this is something that you are interested in, there you go. There is some new preventative services available for depression screening. There is one on obesity screening and counseling. They're going to get us thinned down no matter what they do. And then there is a new preventative service on sexually transmitted infections screening and counseling. Those are the 4 new ones that I found when I went through the book. Okay, many people want to know what kind of changes are going to happen next year due to the health care reform. Well, 2013 is going to be a fairly easy year. 2014 is when a lot of things are going to happen. But Medicare Part D, that's your prescription drugs, and even on your Senior Advantage plans, in the prescription drug portion of that plan, there's something called the Doughnut Hole. Everybody heard of the Doughnut Hole? Yeah. It will be smaller in 2013, and it will continue to get smaller until 2020, when you will only pay 25% of the drug instead of 100%. There'll be more financial assistance in the Doughnut Hole. If you reach the Doughnut Hole in 2013, you will only pay 47.5% instead of the 50% you're paying this year. So what has happened last year was the first year that the pharmaceutical companies came in and said, we'll pay half. I probably shouldn't say this on television. This goes in the archives, doesn't it? But I think that they were kind of pushed into doing that for us. But last year you paid 50% in the Doughnut Hole, and the pharmaceutical company paid the other 50%. They will continue to do that this year, but Medicare, in addition, will pick up a 2.5%. So you will be paying 47.5% of the price. That would be for brand drugs. For generic drugs, you will pay 79% of the total cost. Increasing coverage will continue until the gap closes in 2020. The other change that will come about in 2013 on 2013's tax returns is the threshold on your tax return for unreimbursed medical expenses has always been 7.5%. Anything over 7.5 you can write off as an expense. Well, in 2013 that's going to go up to 10%, so you will only be able to write off anything that goes to more than 10%. Are there any questions on that? Sir? Okay, the gentleman wants to know, if you hit the gap, can you go outside and buy the price? You can do that anytime you want. And I'm glad you asked that question because I have a suggestion. If you are taking very expensive drugs and you go into the Doughnut Hole very early in the year, and we do have one client that has come in, and a member of that family goes into the Doughnut Hole in February and comes out in March. That's great. I mean, she has a lot of expense in that month, but then she's in catastrophic where Medicare picks up 95% and she pays 5%. If you're in it where you go into the Doughnut Hole early, my feeling is buy everything on the plan, get in it and get out of it, and get into catastrophic where you don't pay much for the drug. But most people don't do that. Most people wait and maybe late October, November go into the Doughnut Hole, and they're never going to get out of it. My suggestion there is, if you think you might go into it in the last couple of months of the year, if you can find some drugs, some of your drugs at lesser prices, buy them someplace else and never get into the Doughnut Hole. And you can do that anytime you want. Okay? You can do that on a Senior Advantage plan also. I'm going to use Kaiser as an example. If you're a Kaiser patient and you go to Kaiser and your doctor is going to give you a prescription, he usually keys it in and he sends it directly downstairs to the pharmacy. And so most people believe, I have to go down to the pharmacy, I have to buy my drug from Kaiser. That's not true. You can ask your doctor for a copy of that prescription and you can take it anywhere you want. So if you could get it cheaper at Costco or Walgreens, you can do that. You're not buying another Part D plan, you're just taking that drug and buying it on your own at some other drugstore where it's cheaper. Okay, any other questions on Part D? Okay, I would like to talk about two things that I have had a problem with this year, and I think Brenda will back me up. I moan and groan and carry on about these. One is ambulance services. Medicare covers ground ambulance transportation when you need to be transported to a hospital, critical access hospital, or skilled nursing facility for the magic words, medically necessary services, and transportation in any other vehicle could endanger your health. Medicare may pay for emergency ambulance transportation in an airplane or a helicopter to a hospital if you need immediate and rapid ambulance transportation that ground transportation can't provide. In some cases, Medicare may pay for limited, non-emergency ambulance transportation if you have a written order from your doctor stating that ambulance transportation is necessary due to your medical condition. Medicare will only cover ambulance services to the nearest appropriate medical facility that's able to give you the care you need. You will pay 20% of the Medicare approved amount, and Medicare Part B deductible applies. This is on page 33. Why do I bring this subject up? Because I've had a number of cases this past year where Medicare has refused to pay, stating the service was not medically necessary. Now, I'm not telling you not to call 911 if you think you have a heart attack, you're bleeding to death, or whatever. But think about why you want the ride. I'm going to tell you about the one case that really upset me a lot, and I think you'll get some information out of this that maybe you might use in the future. The client was a lady who had a blood pressure condition. And she and her doctor went through the process. They discovered what her problem was. They discovered when it happened. They discovered what to do with it when it happened. And they were in agreement on everything she should do. What it was at some point, her blood pressure dropped drastically, and she became very weak. And so the answer was, what they found out for her, go sit in the corner for 15, 20 minutes. It will come right back up and you'll be fine. She never told any of her friends about this. Now, I'm not saying you go out and tell all your friends what all your physical problems are, but she never mentioned this to anybody. And she was out one night. It happened to be at a church supper, a ladies' church supper. And she went out, and of course you know what happened. Her blood pressure dropped. So she very quietly went over in the corner and she sat down. And she was waiting for it to come back up. The ladies she were with were all concerned. They didn't know what was the matter with her. And they're talking to themselves, oh, what should we do? Do you think she's okay? What? She's never done this before. Nobody went over and asked her. What they did do was they called 911. So while she's in the corner having her blood pressure come back up, the police arrived, the ambulance arrived, the EMTs arrived, the fire truck arrived, everybody arrived, and they came in and they said, "Where's Susie?" She looked up, her name's Susie. "I'm Susie, why?" "Well, we're here." She said, "Who are you and what do you want?" "Well, we're here because you called us." "I didn't call anybody." "Well, we understand you have a problem." "I don't have a problem." And I don't know how the word blood pressure came up in this conversation, but one of the EMTs said, "Well, let us take your blood pressure." She said, "Don't touch me. I didn't call you. I don't want you." So they left. about 6 weeks later, she got a bill for $1,500 for ambulance services. Okay? Well, it took us about 8 months. She did not have to pay it. But it shouldn't have happened in the first place. Number one, I would think if you were with, you had friends, you might tell them, hey, I have this condition. If it ever happens when I'm around you, don't do anything, I'll be fine. And secondly, the ladies that night should have gone over to her and said, are you okay? What do you want? And then she could have told them that. But it worked out. But that was one of the 7 cases that we got. And I don't know, we had these 7 cases all in a bunch. I don't know if there was somebody new doing the coding in the ambulance company or whatever. They have slowed down now. But it's just that ambulance is not for the doctor's convenience or your convenience because, oh, well, I have a broken arm, but I can't drive. Somebody else could drive you. Just keep it in mind. But if it is an emergency, you need to call 911. Okay? Outpatient versus inpatient. Staying overnight in a hospital doesn't always mean you are an inpatient. You're considered an inpatient the day a doctor formally admits you to a hospital with a doctor's order. Now, why do I bring this up? Because Medicare is billed differently for outpatient and inpatient. You are billed differently as an outpatient and an inpatient, and there are many things that as an outpatient you don't get covered for. Always ask if you are an inpatient or an outpatient, since it affects what you pay whether you qualify for a Part A coverage in a skilled nursing facility, for instance. I don't know how many of you know, but Medicare does not pay for custodial care in a skilled nursing facility. It will pay for skilled care or therapy if you meet the qualifications. If you have been in the hospital, I'm going to break your hips, okay? You broke your hip, you're in a hospital, you must be in the hospital at least 3 nights. 3 is the magic number. And then your doctor says to you, you don't need to be here anymore, but you can't go home because you need either skilled care or therapy. In case of a broken hip, you need therapy to learn to walk again. So we're going to send you to a skilled nursing facility for therapy. Medicare will pay fully for the first 20 days and partially for up to the next 80 days. But if you have not been an inpatient in the hospital, you do not get that coverage. Now, this wasn't one of the cases we had, but I was just told about a young lady who broke numerous bones. She went into the hospital. She was in the hospital for 3 days. She was never admitted to the hospital, but when sent to a nursing home, they found out that she was not covered for nursing home coverage. So, whose problem is it? It's your problem. You need to ask the questions. So, if you go to the emergency room, this is where it happens mostly. You go to the emergency room, and Medicare covers the emergency room. But while you're there 5 hours maybe, and finally the person who's attending to you says, we're going to send you upstairs for, magic word, observation. You don't know the difference, so you get on the gurney and you're taken upstairs and you get in one of those nice little nighties that don't button down the back, and they tuck you in a bed and they plump your pillows, and you think you're an inpatient in the hospital. You're not. You're an outpatient. Now, if you're an outpatient in the hospital, Medicare gets billed differently, but there are certain things that you're not covered for. And as an outpatient, you are not covered under Medicare for any pills you take. So the other magic thing that could happen is some nice nurse comes across to you with a little paper cup with some pills in it and the magic words, here are your self-administered pills. Okay? Well, this happened to a gentleman, and he came in to see me, and there were 3 pills in the cup. He took them. He was billed $112 for those pills. They're the same pills he takes at home every day. He said, if I'd known that, I would have said, oh, I don't want them. He did have to pay for those pills. So if you go into the hospital, if you go into the emergency room or whatever, you want to know, you want to ask. If you can't ask, whoever's there with you, you want to know, have I been admitted to the hospital? Medicare covers many diagnostic and treatment services in participating hospital outpatient departments. Here's another hint. Generally, you pay 20% of the Medicare approved amount for the doctors or other healthcare provider services. You may pay more for services that you get in the hospital than if you had the procedure done in the doctor's office. So wherever we can save money, we can. There could be co-payments that you pay as an outpatient in the hospital that you wouldn't have to pay if you were an inpatient. Okay? It's just back to ask questions. I hate to say it, but we are responsible for ourselves. Nobody else is responsible. Yeah, they should have told those people they weren't inpatients, but do they care? I don't think so. Okay. We hope we don't get any more of those cases for a little while. Where? Yes. Mm-hmm. Right. That's right. Yes, this lady is saying that when she went into the hospital, certain things happened because you were not an inpatient, you were an outpatient. So, well, that's one of the reasons I'm here today. Don't be afraid to speak up to your doctor when they say, we're going to give you this series of stuff and we're going to do it here. Well, how is this, am I going to be an inpatient, an outpatient? Can I have this service somewhere else? Well, I'm not saying that on television, no. But I think it's up to us to ask questions. We are adults. We are responsible for what we do. Okay, just a little review. There are 3 types of doctors that you will face. Those who do not take Medicare patients. You're not going there unless you want to foot the bill. Those who take assignment. That's basically saying those who have a contract with Medicare agreeing to accepting a certain amount of money for their services. And there are those who don't take assignment, but they will take a Medicare patient. They're a non-assignment doctor, and they can demand a little bit more. So let's look. You're going to see the doctor, and I don't know what you're going to do, but the doctor is going to bill Medicare $125. Medicare never, ever takes the full amount and pays it. So they run it through their little computer, and they say, we approve $100. They drop that $25 off. An assignment doctor will be happy with the $100. Medicare will pay 80% or $80. You or your insurance will pay 20% or $20. The doctor's happy with the $100. That assignment doctor also bills directly to Medicare, gets paid directly by Medicare. You have no paperwork. You go to the doctor, same thing, $125, but he is a non-assignment doctor. He is not happy with $100. And by law, he can charge and collect 15% over what Medicare approves. So Medicare approves $100, he can get $115. Medicare will pay 80% or $80. You or your other insurance will pay 20% or $20, and there's $15 left. Medicare doesn't pay that. That is charged to you. Certain supplemental policies will pay that for you. But the other added thing here is a non-assignment doctor will not be paid directly by Medicare. You will get the check, and then you settle with your doctor. So you have paperwork involved. And I had one little lady one day who just didn't understand. She just they kept saying she owed money, and she knew that Medicare was paying. So I asked her if she'd come in and bring her papers. Oh my, did she have papers. She had all the letters, and all the checks were still attached to the bottom. Well, at least she hadn't spent the checks. Okay. I need to talk about Medicare fraud. And this is something that we're hoping with the new health care bill will be addressed very well, because there is fraud in Medicare like you wouldn't believe. And if we could get rid of the fraud, we might be fine. So in this particular period of time, October 15th to November 7th, all those other companies, all those HMOs and those PPOs have their salesmen out there. Oh, they're going to sell us everything they can possibly sell us. If a salesman appears at your door uninvited, it's a red flag. Home visits from insurance agents are not allowed unless you have given the company permission before the visit. So if somebody comes ringing your bell, just ignore the bell, don't open the door, let him go next door. If a salesperson visits your home or calls you on the phone and says he or she is with Medicare, red flag. Medicare does not make home visits or unsolicited phone calls. The agent is probably from a private company and is selling what they call an alternative plan. You don't want to talk to them either. A salesperson tells you a Medicare Advantage plan, that's your HMOs or your PPOs, supplements Medicare and will not affect your existing plan. We have original Medicare over here. We have Senior Advantage plans over here. You have your choice. But if you take a Senior Advantage plan, it replaces Medicare. Yes, Medicare is still paying for your care, but you are not on Medicare. You are on Kaiser, or you are on Scan or something like that. So if they're saying, oh, this just supplements it, no way. Advantage plans don't supplement Medicare plans, they replace them. A salesperson tells you your doctor accepts the new plan. Don't believe it. Talk to your doctor before enrolling. He may not even know. You might want to talk to the business office and see if they have a contract with that company. A salesperson wants to see your Medicare card or have you sign something. Do not show the salesperson your Medicare card. Remember, that's your Social Security number. Do not sign anything you have not read. Everybody's been told that a million times. They're still signing things they haven't read. And do not sign anything you do not understand. Again, and I'm not looking for extra work, really, but if you get something from somebody like this and you don't understand it, you bring it in. We'll help you read it and tell you what it says. A salesperson wants you to make a decision today. Take your time and do your necessary research. If it's only good today, it's probably not really very good. Okay, we have some special enrollment periods. There are some very general enrollment periods, and there are some that only apply to specific conditions. I recommend that if there is something that you think you need or want to do, you first read Medicare and You, and if it doesn't give you the answer, either call Medicare or contact a high-cap counselor. It is far better to do right and get what you need than to do it wrong and get yourself in a peck of trouble that you may not be able to get out of. The general enrollment periods are annual open enrollment, which is what we are in now. This happens every year from October 15th to December 7th, where you can make changes. You can go from Medicare to a Senior Advantage plan, a Senior Advantage plan to Medicare, a Senior Advantage plan to a different Senior Advantage plan, and you can change your Part D plans. January 1st through February 14th, if you have a Senior Advantage plan, an HMO or a PPO, you can return to original Medicare and you can buy a Part D plan. You cannot go from one Advantage plan to another. It is only available if you want to drop your Senior Advantage plan and go back on Medicare. Open enrollment, general open enrollment is January 1st through March 31st. And this is for those who did not sign up for Medicare when they should have. Okay? So in this particular case, you can sign up from January 1st to March 31st, but it is not effective until July 1st of that year. Okay? The biggest problem I see is people don't know when to sign up. These are the rules. When you turn 65, you sign up for Medicare. Now, I'm coming back to that in a minute. If you are on Social Security disability and you have collected your 24th month of disability payment, you sign up for Medicare. Or if you have end-stage renal disease, you sign up for Medicare. The only exception to that is if at age 65, you or your spouse continues to work for a company that has 20 or more employees, and that company provides you with health care insurance, whether they pay for it or you pay for it, you do not have to sign up for Medicare Part B until such time as that coverage goes away. So if you and or your wife are working and there's more than 20 employees in the one that has the health care, and your wife continues to work until she's 70, you don't have to sign up until that goes away. That's the only excuse there is. If you don't sign up when you should, for every year you do not sign up, there is a 10% penalty on your premium. 10% of the premium is a lot of money, and so you are penalized by that. Are there any questions there? This is a question we get a lot, and a lot of the new baby boomers coming in have these questions. Okay. Okay, the question is, this lady's son is not 65, and he's on Social Security disability, or he's applied for it. He hasn't gotten it yet. He hasn't been approved. He has to receive 24 months of payment. So he will get on Social Security disability. It takes a lot of trouble to get on it. But you get on it. When he gets on it, he will then start receiving his monthly check. When he gets his 24th check, he is eligible for Medicare Part A and B. Mm-hmm. That will continue if he's on permanent. Well, let's make him not permanent for a minute. He's on disability and he's gotten paid for 24 months, so now he is entitled to Medicare Part A and B, and he takes it, and he goes on it, and then he gets better, he goes off it. But if it's permanent, he goes on it, and he stays on that Social Security disability until he reaches his full retirement age, which is 67. And then at 67, the only thing that changes is the name of the check. It's no longer disability, it's retirement. Okay? And while he's under 65, he could buy a secondary Medigap policy. They're more expensive under 65 because they know you need them. But at the age 65, he can then trade that in for an over 65 policy, which would be less expensive. Okay? Okay, when you do go to the doctor, not your Senior Advantage people, but your straight old Medicare, you receive a notice summarizing the services you have received. It's called a Medicare Summary Notice. And these are most likely to be received on a quarterly basis, so they're a little behind on their work. It's recommended that when you receive these, you should review them to determine if they are correct and then file them away in case there's a question. When reviewing them, also take account of the letters that might follow on a line of information. These letters are explained on the last page of the notice and are important to understand them. checked these forms for correctness, compare them to other insurance. Mistakes are made in doctors' offices, and blatantly sometimes they try things they shouldn't do. It could just be a mistake. But let's say you get a summary notice and it says on February 1st you went to see Dr. Smith and he did this to you and he billed Medicare for a certain amount, Medicare approved a certain amount, Medicare paid a certain amount, and you may owe a certain amount. And on November 1st, you were in Paris, France. So, sounds like maybe this might be a mistake. All you have to do is circle that on the paper, return it to Medicare, and they will investigate it. Now, it could be a simple mistake, or, as I said, it could be intentional. We do have doctors who are trying to beat the system. So, if we could just look at these things, a lot of people will take that just like this book. I bet you there, I'm not going to ask you to raise your hand, but I bet you there's some of you who took this book and said, oh yeah, in the bottom drawer it goes. I don't need it. People do this with their summary notices too. You need to look at them. We are responsible for that. Medicare is in a little bit of trouble price-wise and money-wise, and we can help. Yeah, we're the grassroots. There's some out there that we have nothing to do with, but every little bit will help. So we need to do that. Okay, let's see if I've gotten to the end of the book. I think I've gotten to the end. Oh, and I only took an hour. Are there any questions? Yes, ma'am. That's right. Because they did this test, and it wasn't the right test for what you went in there for, supposedly, because they coded it wrong. Yeah, right. But yes, this can happen. So this is something you want to look at. And when you get something like this, if you pursue it, you will find that you can get them to pay for it. Okay. I mean, we can do what we want to do, but these kinds of things do happen. When I first went into this job, I had a lady come into me with a Medicare summary notice, and she said, I thought they paid for, what am I going to say? What did she go in for? No, she went in for cancer, breast cancer. She went in for a mammogram. See, I'm having senior moments. She went in for a mammogram, and she was charged for it. And she came in, she said, I thought this was something I could have. Well, at that time, you could have one every other year. So I said to her, how old are you? And she told me. So I said, did you have this done last year? She said, I've never had a mammogram in my life before. This is the first one. So I called the billing office. And the gal on the phone was very friendly. She said, that's very strange. I've had a number of those this week. I wonder what happened. And I said, could you possibly have coded it wrong? She coded all of those she got that. So she recoded them and rebuilt them. So if you think it's something that Medicare should be paying for and they're not, and also the little letters out on the side that I mentioned, those little numbers mean a lot of things. So look at those forms very, very carefully. Yes.
The Part D worksheet that you passed around asks for date of Part A and date of Part B, and these were important to me years ago when I originally signed up, but I don't have any idea what they are.
Yes, you do. They're on your Medicare card.
Oh, okay. All right.
They're there. Yes.
Excuse me, sir.
We can't hear you on TV unless you go to the.
Just go ahead. Or give me, you can sit there, give me the question, and I'll review. Okay. The question is, now that we have Obamacare for at least the next 4 years, is there anything that will be implemented that isn't in the book? There are things that will be implemented, but they won't be effective to you. It will be how they maybe bill hospitals, or what they're looking at in hospitals is, how many times does a patient come back for the same thing within a month? Are you really doing the job? They're looking at having hospitals and doctors do a better job, and perhaps changing the way they pay for these types of things. For your Senior Advantage plans, which were started in 1985 as an addition to Medicare, because they thought it was a less expensive way to go, has proven that it was not a less expensive way to go. They are going to start reducing the amount they pay the Senior Advantage plans. It will not affect the care that the patient gets at all, because it's tied to the efficiency they have. 80% of what they get must be for patient care. It cannot go to administrative expenses. So those kinds of things are the ones that are going to happen perhaps in 2013. Okay, will some of the specialists not offer their services? Oh, probably. There are doctors who do or do not want to work with a Medicare patient because of the way they're reimbursed. They're going to change some of the reimbursement, and it looks like primary doctors might get a little bit more, and specialists might get a little bit less. Those things will kind of work out. A lot of people were worried that we're not going to have any doctors, they're all going to drop Medicare. Baloney. You know what? Most of the doctors only have practices because all the patients are Medicare, so they're not going to drop it that way. You will see some slight differences here and there, but it's not going to be horrible next year. Okay, the lady asked, is there a time span where you should save your forms? If you are fighting something, if you have a problem, then you're going to save them as long as it takes to solve that problem. I personally save last year's and the current year. If there's nothing that I'm fighting or nothing that hasn't been paid or so on, then I figured just having 1 year in the back is enough. If you wanted to do what they suggest you do with your income tax, 3 years. Okay, one thing I didn't mention, and one of our members of the council had asked me to talk a little bit about federal employees and federal health care coverage. Don't we all wish we had federal health care coverage? It is fantastic. When somebody retires from the federal service, they have a choice of keeping their federal insurance as their coverage, or they can go on Medicare and have that federal insurance become their secondary insurance. If they give that insurance up, they have to really think about it, but if they give it up, they can never get it back. This is true also of school teachers with some of the PERS and the STRS plans, and it is also true with some retirement plans, regular retirement plans. You need to know what your plan does. First you should know how it covers you, but if you want to make some changes, you need to know what that plan does. For instance, some of the school teachers in every district is a little different, but they have plans of their own, and if you buy a separate Part D plan, you just lost your coverage from the school district. So you want to know that before you do it, okay? Some plans, you have Medicare coverage and Part D kind of rolled into one. If you drop the Part D part, you lose your medical coverage as well. Others, you can drop one part and keep the other part. Some plans, I was working with a lady just before we came here today. She has coverage, and she has medical and Part D. She doesn't like her Part D. It costs too much. She wants to buy a standalone plan. Questions to her were, if you do this, do you lose your coverage? And she said, no. They tell me I don't. I can keep my Medicare coverage and drop my Part D, and if I don't like what I buy, I can go back to my Part D. My question was, you said they said, do you have anything in writing? I think having that in writing is the important part, so that if something goes awry, you can say, hey, look at this, I have this. So you have to know exactly how that plan works. So if you're not retired, when you retire, make sure you get a human resource book telling you about your benefits. If you are retired, you could go back to that company and request that you get a book like that. And if you have friends who are going to be retired soon, you might advise them to know what they're covered for before they step out. Okay, I think I... Yes. Oh, dear. Hmm. Okay. That's true. Okay. Mm-hmm. Mm-hmm. Okay, well, there are many, many things that come into this, but I want to go back to your first statement, that you got hurt on the job, and Medicare didn't pay for that. Medicare was not responsible for that, because you were hurt on the job, and there was another insurance that should have paid it. Okay. There are many, many questions that come into that. I would be glad to talk to you separately about this and talk to you about what happened, but you did bring up a good point that I want to remind the rest of you about. Is Medicare is your primary insurance unless there is someone who is responsible for the cost. For instance, you are in an automobile accident, you are not at fault, the other person is, you go to the hospital, that other person's insurance is the primary insurance. Medicare becomes secondary to it. So it's not always Medicare who's going to pay the bill just because you are a Medicare patient. And maybe I can put something in the paper, the column that I write, and we can take care of that. But I think I've taken up my time. Okay. Okay. Okay, these are the type of questions that we need to delve into more, and we would do it on a one-on-one person if you want us to. Yeah, But there are questions, but people have to be aware that Medicare is not always top dog. Okay? Okay, Jim, I think that's it.
Yes, Betty, thank you very, very
You're
much.
quite welcome.
And I think we have a coda from Brenda.
Francine has let us know that the rooms next door where if you came in early and you had some food, those are going to be available, and Betty and I can stay and help people over there if you have questions or if you want to sit down at a table and fill your forms out. The rooms are available over there.
Thank you, Brenda. Thank you, Betty. All right, we'll be moving on, and I'll turn the meeting back over to Vice Chair Leonard.
You're going to be amazed at how fast I hit it right back to Jim. We are now on the next point of the agenda, item 6, liaison report. So, James, will you help us with that?
Yes, our first liaison report is from the retired senior volunteer program. Martin?
Well, the Holiday Boutique is now going on right now at the RSVP.
Closer to it.
Closer to the mic.
Oh, sorry. Holiday Boutique is on now at the RSVP office, which is at the Global Adult Community Center. And they have glassware, ceramics, costume jewelry, knit baby items, slippers, sweaters, Afghans, kitchen items, the 50-cent greeting cards, which are very popular, and much more. Proceeds from their sales are donated to worthwhile causes, such as Lifeline, which connects seniors to emergency services. So I urge you and all your friends to look over what they have.
Okay, thank you very much, Martin. Okay, it's my understanding that there are a great many interesting and wonderful things going on at the Global Adult Center. Could you verify that for us, Andrea?
Yes, I will. Thank you. Well, I'll just follow Betty here. And yes, the Medicare one-stop shops are Thursday, November 15th, or Friday, November 30th from 9 to 4 p.m. at the Global Adult Center. And you have to call and make an appointment. No ifs, no ands, no buts. But you do need to call their phone number. So it's 805-495-6250. So if you want to get on that list. So make sure that you do that. All right, now the next fun and wonderful good things that are coming up. If you missed it, Betty just did the will you pass your next driving test, and we had 62 people in there. So her next ones won't be till way later. Yes, January somewhere. Anyway, that was a really good one. We still have the Meaning of Opera and the fun of it coming up November 12th, which is next week, and the 26th. We are doing an awesome art reception tomorrow. We have a lot of our senior artists. Their paintings are up on the wall in our Marquee Cafe, our dining room. So you can come and meet the artist, have some good food, and really look at some really cool art. So make sure you definitely come to that one. That's going to be from 4 to 6 on Thursday. Let's see. We have Showbiz After 50. So this is going to be on Saturday, November 10th from 9 to 11. And this will be really fun because if you've ever thought about doing that or getting into the commercials or anything like that after retirement in TV film, we've got a couple of really cool people in the area that are already doing it, and they'll kind of give you the ins and outs of it. Braille on next Friday is going to have their low vision fair at the center. So you can come see a whole bunch of different free low vision services, and they're going to focus on the latest stem cell research regarding macular degeneration and diabetic retinopathy. Excuse me. Oh, there we go, retinopathy. Yay! Somebody from the audience. So anyway, that's going to be taking place. If you do need more information on that, you need to call 805-886-6025 if you need a little more information or something special and you want to see if it's there. And we have the Medicare One Stop Shop. We also have Social Security. whole good program, but it is going to be at the Reserve, and that's going to be Saturday, November 17th from 11 to 12. And you do need to call their number, and that's 338-7531. The Global Center and the Reserve are teaming up to do that. So they'll be going over all the stuff that's to be a significant source of your future income for many of us, or your sons and daughters, like myself. So decisions that people make, as Betty was talking earlier, just with Medicare, decisions they make now can impact you later. So you definitely need to make sure of that. And the Kiwanis Club, on Thursday, November 29th, they are offering a free service in which you can do it yourself, or you can bring in your family or your grandkids, and they're going to do one free portrait. And it's a great holiday gift, and you get it, so you'll be able to make copies if you wanted to. But they are doing that as a free service, so you'll have one really nice portrait. You do have to make an appointment, so definitely call the center at 805-381-2744 because they are on 15-minute time frames. You can't just show up. Also, the Rotary Club is having their annual holiday breakfast that they do at our center. And it's always really, really early in the morning, but it'll be Friday, it'll be in December, mind you, December 14th from 7 a.m. to 9 a.m. But it is really fun because they dress up, they've got a great breakfast, there's prizes, everything's all decorated. So we're all up very early. We will be taking registration for that starting next Monday. And yes, we are open Veterans Day. So we're fully gung-ho next Monday, so don't worry about it. So you can call starting next Monday to get on for that. And we've got some new trips going on sale, and those are going to be this Friday. So we have a Candlelight Pavilion, we have a Warner Brothers studio tour with lunch, and Buffalo Bills and State Line. So if those interest you, come in on Friday morning when we start registration. Any questions? No? Okay.
Thank you, Andrea, and thank you, James. We are now on item 7, Commissioner comments, special events, et cetera. Commissioners, do we have? Nancy? Okay, we'll go this way. Nancy, go ahead.
First, okay. I just want to talk about a program that is coming up that really does sound like a wonderful opportunity. It's called Are You Fit to a T? Do you know your own blood pressure? Do you know your cholesterol level? Do you know your weight? What is your T-score? If you had to think twice about what a T-score is, and no, you don't know, it's not a golf term, surely you are not alone. It's all about your bones. If you want to shop till you drop, golf till your legs ache, and line dance until you're 84, knowing that your bones won't let you down, here's what you need to know. There's a free program open to the public. It is called Fit to a T, Bone Health and Osteoporosis Education Program for men and women of all ages. The speaker is Cheryl L. Lambling, MD, FAAFP, Ventura County Healthcare Agency. When is going to be Tuesday, November 13th, 2012. The bone screening is going to be between 6 and 7 p.m. The education program is from 7 to 8 p.m. Seating is definitely limited, and reservations are definitely recommended. The number is 805-381-7362. The location of the program is at the Thousand Oaks Library, the Marvin Smith Community Room on Jans Road in Thousand Oaks, the Thousand Oaks branch of the library. The free bone density heel screenings are courtesy of the Alta Medical Group, and a sampling of light bone healthy refreshments will be provided. But it's a really good opportunity to get some information that could make a big difference in your life. So here's the information. If anybody needs a flyer, I've got one. I don't know if we have any. There are a whole bunch over here, so please take one.
Thank you, Nancy.
Mm-hmm.
Jim?
Yes, while we're talking fitness, I'd like to remind everyone to either attend or watch our December program, which will be the first Wednesday of December, and it's going to be brain fitness. So learn all the little tricks about how to keep your brain active, alive, and well, and come down and join us, or if you can't, be sure to watch us.
Thank you, sir. On my right side, Mr. Fotheringham, anything? Mr. Nurkin and Ms. Wing? Nothing. Thank you. For those of you who are here, and especially for those of you who are in the watching audience and for the archives, for the last several years, under the guidance of Jim Searden and others, but principally Jim, we've had some wonderful programs. And the programs are in the archives, and I point you to them. But last month, we had a wonderful program called Boomer Boot Camp in cooperation and coordination with Senior Concerns, at which we had something like an average of 260 people a night for 3 successive Wednesday nights. It was an outstanding success. And having Betty and Brenda here this afternoon is also an example of what Jim and his people do. And that kind of a program, as was today, is always an outstanding success. So on behalf of the Council on Aging, I'm pleased to thank Andrea Gallagher and Senior Concerns and all of the people there. The people on the council here, Jim Searden and his planning group, and staff support, and everyone else for the wonderful job that was done on that program last month. And that's all I have. Anybody have anything else? Thank you. This meeting is adjourned.